Well, today we have Dr. Prashant and he's practicing in Agra, Uttar Pradesh. Well, today we're going to be talking about kidney stone management. Very welcome, sir. So, very first question is going to be why you think the cases of kidney stones are on a high rise and a constant rise these days?
That's a very important question, and there are multiple reasons for that. One of them is that we have got better diagnostic tools to detect stones. So more and more people are getting CT and X-rays and ultrasounds done. So it's easy to pick up. Earlier there were only X-ray was available. So we have got better diagnostic tools. The other is changing lifestyle, which means that people are on the outside working, so they are getting less water. So this leads to dehydration, and this might be the cause of increased formation of stones. So I think probably these are the two important reasons for it.
Yes, sir. So, when we are talking about kidney stones, I would like you to recall one of your most challenging cases where the patient was there and the case was critical and how you dealt with that patient. How did you remove the patient's stone?
Yeah, many a times kidney stones, which are staghorn stones, these are pretty difficult stones, and they pose challenges every time. But one of the lady, she came to me with from Guwahati, and she had bilateral complete staghorn stones, and I operated her 4 times. Then I could clear her stones, and she was to be operated in Guwahati earlier, but then they refused and she came to me. So that is probably one of the most challenging cases, because I operated her for 4 times, and she was with me for a month. Every week I used to operate, and so I think probably that was a very difficult case.
So, what makes it very important for the patient to get the stone diagnosed at an early stage and not delay the process?
Yeah, that's very important that stone should be diagnosed early and treated early, because if they are not treated early, then the possibility of complications is high, and over a period of time these stones would grow and lead to poor function of the kidney, and we are very much worried for that. So stones, if detected, should be treated as early as possible rather than allowing them to grow and cause complications.
Well, we also have a great misconception when it comes to kidney stone. So, if you would like to break any of them.
Yeah, a lot of misconceptions are there. This one of them is that very little small stones, people are very reluctant to get them removed. So let the doctor decide that what stone requires surgical management and what stone requires medical management. So that is very important, because a lot of people would, depending on the size, would think that it requires medical or surgical management. So this decision should rest on the doctor rather than the patient. And the other myth is that if you treat them surgically, the chances of recurrence is high. So that is not the case. So if you are properly operated, you would do fine in your life. So I think people are very reluctant to get operated because they say that it will increase the chance of recurrence. So I think these two myths are very important to be broken.
Well, what do you think is going to be the next breakthrough when it comes to kidney stone domain?
Uh, the big breakthrough is already there. Flexible scopes are there, newer medicines being developed, and surgery is done without holes or without skin incisions or without skin stitches. So these are already there, but I think artificial intelligence will definitely come into the role of management of stone disease in future time.
Right, right. Any take-home message for our viewers?
If there is a stone, you should consult a urologist and work according to their advice. That is very important.
Thank you. Thank you so much, sir, for your valuable insights. Thank you.